Hi, it's Dr. Weiss. I'm in the operating room today, and we are repairing a fracture of the fifth metatarsal that is about 3 weeks old. This patient didn't know she had a fracture. However, she injured her foot, walked on it, and it moved a little bit, so unfortunately we have to fix this with a small plate. As you can see right here, here is our fracture at the fifth metatarsal. And you can also see how it had separated from walking. In between the two bones, there is what we call a hematoma, which is a collection of blood and scar tissue that starts to form after the fracture. And we're going to put this back together and put a plate on it. What we're doing is we're going to put some bone graft substitute here. You can see some of this. And that helps, there it is, it helps the bone heal quicker. And we do this sometimes when there's bone that has some osteoporosis in it to get it to heal quicker. So we put the bone back together, we put a little bone graft in there, and here is the titanium plate that is on the bone with the screws, and this will heal over the next 4 weeks or so. And she'll be able to walk on it, and the fracture is now fixed. Thank you.